way that I approach cryoablation as a surgeon is that I'm trying to achieve with cryoablation what I would ultimately try to achieve with surgery. In surgery, our goal is to remove a tumor with clear margins, and we accept margins as narrow as non-transection, no tumor unique, less than a millimeter, as long as the margins are clear. Of course, with cryoablation, we don't have the ability to check margins, so we have to assume that the tumor is potentially larger than we think it is and treat with a generous margin. And so instead of accepting a 1 millimeter margin as I would accept in surgery, my goal is to try to ablate at least a 5 to 10 millimeter margin with cryoablation, recognizing that the tumor might be a few millimeters larger than it actually appears on ultrasound. So the goal is to achieve a 5 to 10 millimeter margin, and you can do that by simply using the standard 8-10-8 freeze, thaw, freeze cycle for a typical 1.5 centimeter tumor, or you can add additional time to either freeze cycle to grow the ice ball to a larger dimension. And there are even cases that, where sometimes they use two overlapping ice balls to free a much larger margin around potentially a larger tumor. There are situations, however, where it is so adherent to the mass or close to the mass where we can't feel like it can safely inject saline or local. In those cases, I treat not just the mass, but the adjacent muscle as well, because the muscle is in fact the margin that needs to be addressed with cryoablation.